everyone, I'm Shannon Morale with Tax Analysts. Thank you for joining us today on Facebook Live for the latest installment in our weekly discussion on tax reform. Now, this has been a very exciting week in Washington, D.C. As most of you know, on Monday, the House Republicans released the American Health Care Act. And as we speak, the Ways and Means Committee is actually doing a markup of the bill. Now, the American Health Care Act, or the AHCA, another acronym, very difficult, is actually a bill intended to repeal and replace Obamacare. And it is chock full of tax provisions. So today we're going to take a look at the tax aspects of the bill and look at their potential implications. And to join me in that discussion is Bob Goulder, Senior Tax Policy Counsel for Tax Analysts. So thanks for joining us again today.
Thanks for having me on the show.
We always love having you. So to start us off, let's take a look at what those tax aspects are and how would they change the tax code if this was implemented?
Yes, well, you hit the nail on the head. This is a healthcare story, but the way we see it, it's really a tax story.
Yes.
Because both Obamacare, or the ACA, and this proposed repeal and replace measure are full of tax provisions.
Yes.
The two concepts, the two policies are just intertwined. You can't do healthcare as a practical matter without involving the tax code. For better or worse. Some people would say that's good and there's an efficiency there.
Sure.
The IRS is an agency that, because of its mandate to enforce the tax laws, it's dealing with pretty much everybody in the country, and you don't have to create a new bureaucracy, you just use the IRS. So it's sort of a natural fit. I suppose on the downside, when you think about it, the IRS then has two tasks.
Yes.
They are
huge task.
Huge task, monumental task. They have to raise enough revenue to pay for all the spending that the federal government does, or most of it. They don't actually pay for all of it. But then in addition, they have to sort of manage this healthcare stuff, and it's a burden on them because it gives them two things to focus on. So yes, it's full of tax provisions. The first thing we should point out, though, that everyone's calling this repeal and replace, which is fine. And the Republicans from the outset, from the campaign, were clear that that's what they wanted to do. They'd like to do it as quickly as possible, I think, too.
It's happening.
Maybe do it through reconciliation, do it without any attempt to be bipartisan. They don't think they're going to get Democrats to come on board. But they're not truly replacing everything. So the starting place that I would like to talk about, and we'll just mention it briefly, is that there's two big patient protection provisions in Obamacare that the Republican plan would retain. One is the term for pre-existing conditions.
Sure.
It kind of goes without huge, because you think about it, insurance companies know all about us. They all know all about you. They know all about me. They know all about everyone. They've got files on us, what our allergies are, whether we're lactose intolerant. I mean, anything related to our health conditions, they know all that stuff. And because they're profit-seeking enterprises, right, they can adjust the premiums that they pay. So if you're very sick, if you're chronically ill, say someone with cancer, and if that's in your file, they could say, we're just going to deny you coverage.
Because it costs a lot of money.
Because it costs a lot of money, and the premiums that you pay probably are not going to compensate for the costs that they're going to have to cover. So they could deny you coverage, or they could just jack up the premium so that it's outrageously expensive, and they price you out of the market that way. Most people, regardless of whether they are Republicans or Democrats, or whether they live in red states or blue states, that worries them a little bit, because they or their loved ones and their families could get really sick. So the Republicans weren't stupid. They said, yeah, we're going to retain that. And the other thing that they decided that they would keep, it's an issue that polls very well. It's about young adults. Families can keep their kids on their plan until they're 26.
26,
And, you know, they've done public surveys, and there have been polls, and it polls very well. And, again, Republicans aren't stupid. When everybody likes that, except for maybe the insurance companies,
there you go, let's keep that
they're going to keep it. So it's not a complete repeal. They would keep that.
Okay.
Yeah. But everything else goes away, and the big thing that goes away is the mandate, and that is a tax issue. There are two mandates, actually, the one mandate is for large employers. You have to provide certain types of policies for your employees. But the one that everybody talks about is the individual mandate. Says you have to go out and buy insurance. And that's a sensitive issue. It was litigated, it went to the Supreme Court, the big case, King versus Burwell. When the legislation was being passed, nobody really talked about it as a tax. They talked about it as a fee or a penalty or a assessment or something like that. But when they had to litigate that and argue it before the Supreme Court, the only way to pass muster really was to say, yes, this is a tax. And it is through the tax code that they do that. So that individual mandate would go away. So if you're an individual and you have to think, should I go buy insurance or not, if you're not getting it somewhere else through your family, through your parents, your spouse's policy, but most people get it through work. You do not have to go out and buy it. You can do that and you don't have to worry about being hit with that penalty. Although, this is one of the reasons why it is very murky, because there is something in the Republican plan called the CCI provision, which is for continual coverage incentive, which is not a mandate, but it's kind of sort of like a mandate, because what it says, what it says is if you got insurance and then you decide, hey, the mandate's gone, I'm not going to buy insurance anymore, then you're not covered. But they actually do want you in the insurance pool, and I think the insurance companies probably visited with Republican lawmakers and tapped on their shoulder and said, we cannot have an insurance risk pool that's comprised solely of old people and sick people because the economics don't work. You need to have a little bit of pain, economic pain, not physical pain, but you need to inflict a little bit of pain on people to encourage them or incentivize them to stay insured, especially younger, healthier people. Now, the mandate was the obvious direct way to do that, saying you have to buy insurance. What the CCI does, it says if you lapse, if there's a lapse in your coverage, meaning if you stop buying insurance and then a year later or so you think, you know what, I probably should get insurance. So then you're covered, then there's a sort of hole, this empty period where you're not covered, and then you go back on. When you go back on, you get hit with a 30% penalty. And we don't know the details, but presumably that penalty will be administered through the tax code. Because frankly, I can't think of any other way that you would reach the entire country. So you could say, and this is maybe a bit of a cynical view, but you're getting rid of the mandate, but then you're having the continual care incentive. You're kind of substituting one tax penalty with another.
All right, well, that's big stuff right there. So the insurance mandate from Obamacare would be gone. That's obviously a huge change. And people would no longer face that tax penalty if they didn't go out and acquire their insurance coverage. But what about costs? Insurance coverage, like we just said, is very expensive if you're not getting it through your workplace or through your husbands or wives or whatever. So you've got your monthly premium payments, and you've got your deductibles, and you've got your co-payments. How would the American Health Care Act, or the AHCA, try to make healthcare more affordable?
Oh, yes. Well, this really is central to what the Republicans are trying to do. They want to expand coverage by making policies more affordable. Now, easier said than done, let's be honest. As you just said, there's the co-payments and the deductibles and the premiums. There's a lot there. But in theory, if you could make it really inexpensive or less costly, I don't know if insurance coverage will ever really be cheap.
Probably not.
No, not if you want a good policy that covers a lot of things. But how do you make it cheaper? Well, they've got a two-pronged approach for dealing with that. And the first thing we should talk about is a tax scheme called HSAs, health savings accounts. They're not new. They're not created by this plan. They were not created by Obamacare. They've been around for a while. Conceptually, they're a little bit like an FSA, a flexible savings account.
Untaxed.
Even a little bit like a 401k or an IRA, in the sense that you've got a job. So you're getting a paycheck, your salary and your wages. And in theory, all that goes into your taxable income when you do your taxes at the end of the year. But you are allowed to exclude a certain amount of your salary and wages from this category of gross income. It's not considered taxable income. So it's gross income, it's not taxable income. And the money that you put into one of these HSA accounts falls into that category. So what it means is when you then go and spend it, you're spending pre-tax dollars rather than post-tax dollars.
So in theory, saving some money there.
Well, you are. You're definitely saving some money because everybody, as long as you are paying taxes, there's a difference between your pre-tax dollars and your post-tax dollars.
Yeah.
Now, the amount, we'll get to that later. It depends on your rate. Yes.
Yeah.
If you're affluent and you're in a one of the upper income tax brackets, say the top income tax rate is 39.6%, so let's just say 40%. So then, ignoring state level taxes, just looking at federal tax burdens, there's roughly a 40% difference between going out and spending pre-tax dollars rather than post-tax dollars.
Yeah.
So
quite the incentive right there.
Yeah, a very, very nice incentive right there. Now, you can't use this money for anything. You can't use it to pay for a ski vacation or a new bicycle. You can't use it to pay, make a car payment or pay down your credit card debt. You can only use it for medical-related expenses. And here we're not really probably talking about using it to pay for insurance premiums, but to pay for actual costs. Like you could use an HSA to pay for your deductibles or to pay for your co-pays. Or the classic example are prescription meds.
Yes.
So say you're diabetic and you need insulin and you have to go all the time to get insulin. And you could pay for it with your pre-tax dollars. So there's a big savings there.
Absolutely, yeah. Anything you can do to help there.
Yeah. Yeah, so what the Republicans want to do, they want to expand this because, as I said, HSAs already exist.
Yeah.
But there's caps on them. For example, here are the current caps for 2017. If you're an individual, you can only put $3,400 in it.
Okay.
Over the course of the whole year, $3,400.
Okay.
For a family coverage, there's sort of a variation on an HSA where the beneficiaries are your entire household rather than you. For a family plan, it's about $6,800, roughly double. What the Republican plan would do is they would increase this. The individual ceiling or limit would go up to $6,500, and for families, $13,500. Okay. So you could take your income, and we're probably talking about disposable income here because they're pre-tax dollars. But if you've got a mortgage and you've got rent to pay, you want to put food on the table, you're going to do that there first. So. You could take more of your disposable income, assuming you have the disposable income, and push it into these tax-preferred accounts, and then spend it later. And they're also talking about expanding the various categories of uses. So with HSAs, there's two takeaways. The plan would let you contribute more into them, and there are more things that you could spend them on. For example, they're talking about over-the-counter drugs. So in theory, you could go to CVS and get your vitamin C, or if you're taking a calcium supplement, things that weren't previously covered because they weren't prescriptions. So more uses and greater contributions.
Okay. Yeah. All right. So let's talk about the politics behind these health savings accounts that you just described so well. As you mentioned, they're not a new invention. They've been around for quite some time. They're already in the tax code. Can we predict how lawmakers are going to react to giving them, more prominence?
We sure can. Democrats hate this idea, and you can already see it. You can see it on Twitter and Facebook and LinkedIn and social media. There's a buzz out there. Republicans generally really like HSAs, and Democrats hate them. And the reasons are simple. We don't need to spend too much time on this because the reasons are so simple. Republicans like it because it's your money. You're taking your own money that you earned from your paycheck, and that's what you're spending. So it's not a handout. It's not like welfare. It's not an entitlement. It's not money from the general public fisc that we're giving to you to support your health care expenses. It's your own money. And that means you're going to be frugal. You're probably not going to waste it. It's normal human nature to be more, I don't want to say cheap, more strategic, more discerning, yes, when it's your own money. So if I have to go buy lunch today, and I'm paying for it with my money, I might think about what's on sale. But if I know that Shannon is paying my lunch, I'm having steak and champagne and 2 desserts at least.
Thanks, Bob.
Yes, but that is really a key here. Republicans look at HSAs and they don't see a public entitlement. It's your own money. Now, the flip side of that is the Democrats say, wait a minute, okay, the benefit here we get, as we talked about, you get more bang for the buck because you're spending pre-tax dollars instead of post-tax dollars. But who does that benefit? I hinted at it before. If you're in the 39.6% tax bracket, that's a 40% savings for you. You're getting 40% more out of the money you spend through an HSA because of your tax bracket. But say you're less fortunate, say you're in the bottom tax bracket, say your marginal tax rate is 10%. Well, now there's only a 10% differential between your pre-tax dollars and your post-tax dollars. So a person in the 10% bracket is getting a small benefit that's only a quarter as much as a more affluent person. And the argument follows, if the whole purpose of the healthcare legislation is to help people at sort of the bottom of the socioeconomic scale, why would you design a feature that benefits Bill Gates or Warren Buffett, somebody in the top bracket, 4 times more than it benefits the working poor?
Yeah.
So they both have. Both of those arguments have some legitimacy to them.
Oh, sure.
The Republicans are right; it is your own money, and the Democrats are right. It is sort of skewed towards delivering a greater benefit to people in higher incomes. So that's not fake news. The arguments will withstand some intellectual muster there, but it just comes out with the preferences of what your priorities are going to be. So yes, HSAs, you're going to be hearing a lot about them. You're going to be hearing them on the news tonight when you go home, in the papers tomorrow. You're probably going to be stuck hearing about them for the next couple of weeks or months.
Right. I would say probably months. Okay, so you mentioned tax credits before.
Yes.
And that's also been identified as another main way that the GOP plan helps to make it easier for people to acquire health care and health insurance, I should say.
Yeah.
So what are the details there? Why do some people think that tax credits are good alternatives to Obamacare?
Yes. Well, this gets complicated. There's no way to address it without getting into some of the minutiae.
Okay.
But this really goes to the heart of the GOP plan. Like I said, there were 2 prongs. One was the HSAs. The other is changing the tax incentives. Under Obamacare, you have what are basically tax credits. They're called, premium assistance or premium subsidies.
Okay.
So that if you don't make a whole lot of money, say you've got low income, and they can tell that by looking at your tax returns, then you get tax credits to go out and help you buy insurance from these marketplaces that have been set up. But those tax subsidies are tied to your income. So they go away if you make more money. So they're aimed at helping poor folks buy insurance. What the GOP plan does, it gets rid of those and it replaces them with another type of tax credit based more on your age.
Oh.
Right. So it has less to do with your income. I mean, there's one little factor we'll get into that it relates to your income, but let's review this. So the tax credits that you would get under the GOP plan, they're tied to your age. For people under 30, say if you're 25 years old, your annual credit would be $2,000.
All right.
Okay. Now, when you think about it, when do you claim a tax credit? Most people claim tax credits when they're actually doing the math when they're sitting at the kitchen table, or they're more modern than that. April 15th, they're doing a TurboTax or something like that, software. But that is in the spring of the year following the tax year in issue. So it doesn't help you a whole lot to say, okay, you've got this year, a 12-month period where you're going to have to pay for insurance. And then on April 15th of the following year, you get a tax credit. So what they've done is they've made it advanceable, which is a strange little word, but it's going to come up. The tax credits here are advanceable, meaning you're going to get them as a form of a monthly allowance, just like you get money every month. You get a bill every month because you have to pay the insurance premium. Presumably, right around the same time, hopefully a little bit before you'd be getting the bill, you'd be getting a check from the government, which does sound like an entitlement. Let's be honest. It's a tax subsidy. It's a tax credit, but you're getting it up front. Okay. So you don't have to wait till you do your tax credit. So It's advanceable. That's the first thing to know. And it's $2,000 if you're under age 30. And the amount goes up with every decade of life that you've managed to pass.
Yeah.
It goes up $500 for every 10 years. So if you go from age 25 to 35, it would go to $2,500. If you go from age 35 to 45, it would go to $3,000. And it continues, but it's capped at $4,000.
Oh.
So for somebody 25 years old, starts at $2,000,
Yep.
and it will eventually double to $4,000 per person, and it can never go higher than $4,000 per person.
It stops right
It stops.
there.
Also, if the tax code has this concept of taxable households, you know, you don't just look at the individual, you look at the family.
Yeah.
There's a family cap as well. Under no circumstances would the tax credits for a household be greater than $14,000 a year.
Okay.
So whereas under Obamacare, your tax subsidies are directly linked to your income, these tax subsidies or these tax credits are linked to your age. Now there's a little caveat here. They did throw one measure in that looks at your income. It's a way of sort of phasing this out for people who are more affluent. So
Sure.
you can't say that the GOP tax credit doesn't look at your income at all. It does look at it sort of as an afterthought here. If your taxable income exceeds $75,000 a year, they start to phase out those credits. With the theory, you're making enough money, you don't need as much help.
You can contribute a little.
So there's a formula here. You lose $100 of the annual tax credit for every $1,000 you are above that threshold. So if you made $80,000 a year, that's $5,000 over the $75,000 threshold. So you would lose $500 of your tax credit.
Okay.
So if you were a 25-year-old making $80,000 a year, you'd start with the $2,000 credit, but then you'd lose $500 of it because you'd be at $1,500 because your income is greater than $75,000. So you can't say that it is blind to how much money you make, but the real motivating force there is age. The other thing I mentioned, the advanceability.
Yes.
It's also refundable. This is a big thing.
Oh.
Yes. When Democrats first heard that Republicans were going to have these new tax credits, they said, well, what good is a tax credit if you don't have taxable income to offset? And there's a large segment of our country that just doesn't make enough money to pay taxes.
Absolutely.
Or they have taxable income, but it's offset by things like the child tax credit or the earned income tax credit. There are these other measures in the tax code that will zero out your tax liability for people at the lower income scales. These tax credits are refundable. So if you imagine a case where, let's say, your total tax bill from the IRS is $2,000, but you have a $3,000 tax credit, you would use $2,000 of it to wipe off your taxes, and then you'd have $1,000 left over, a surplus. You'd get that back to you as in the form of a tax refund.
Okay.
So you would still have the IRS administering health care, because the IRS are the ones that would have to give you the refund for this refundable credit. So there'll be a lot of talk about the refundability here, because Republicans are going to point out that the charge is going to be that they're throwing the poor under the bus here.
Yeah.
Because generally speaking, these credits aren't as generous as what you got under Obamacare. Their rebuttal is going to be, oh, but wait, they're refundable. So, so that influences the political debate.
Absolutely. Okay, so we talked about the mandate. We talked about the related penalties, that they would be repealed. We've talked about HSAs and tax credits.
Yes.
What other tax provisions would be affected by this?
We have a long list of tax provisions,
wow.
Shannon. It just keeps coming. It just gets better and better. More tax to talk about.
We did say it was chock full of tax provisions.
We did say that. We're being honest. Here's a list of some of the taxes that would go away. There's a medical device tax in the form of an excise tax. That's repealed. There's a Medicare hospital insurance surcharge. That's repealed. Taxes on prescription and non-prescription drugs that are part of Obamacare, that's repealed. There's something called the Cadillac tax. The Cadillac tax is not a tax on cars.
Go figure.
Go figure. It's a tax on individual health insurance plans that are just a little bit too luxurious.
Oh,
you know,
like a Cadillac.
Like a Cadillac, something very posh. Imagine there are different levels, and you see this with Obamacare. They try to describe the level of coverage using terms like a bronze plan or a silver plan or a gold plan. I think platinum. I always get confused. Would you rather have platinum or would you rather have gold?
Better?
Which one's better? Well, platinum is better than gold.
Yes,
But if you have a plan that just say covers everything, it's just like the perfect
creme de la creme.
Creme de la creme. They tax you on that. Now that tax under Obamacare, it's actually never gone into effect.
Oh.
Even though Obamacare was passed a generation ago now, 8 years ago almost, the Cadillac tax has never gone into effect because it keeps on getting delayed and delayed. And the reason is that there's bipartisan opposition to it. Republicans don't like it because it's another tax. And a lot of Democrats don't like the tax, the Cadillac tax, because it would hit union people. There are some union members out there who, when they're, say, when the AFL-CIO or the UAW, the auto workers, say they're negotiating a new contract with Ford or GM, and those guys come back and say, look, we just can't give you any more salary. We're already paying you enough. And that negotiation between labor and management, they've learned over the years, well, if you can't compensate us with salaries, compensate us with really good insurance.
Sure.
So you have this ironic situation where, although the Democrats generally support Obamacare because it's President Obama's signature legislative accomplishment, they don't like the Cadillac tax because there's a lot of union guys who are going to get hit by it.
Yeah.
Because they've got really good coverage, but they negotiated that. So the Cadillac tax, you don't have to worry about delaying it. It would be gone.
Gone.
Right. The list continues. There's something called the tax on net investment income. It's a 3.8% tax. It applies to things like interest income, dividends, capital gains. That would be gone. It has nothing to do with health care directly. It's just a funding mechanism to come up with money.
Okay.
Yeah. It also would alter the GOP plan, would change how we do our itemized deductions. If you think about your tax return, which you should be thinking about this time of year,
right about now, yeah.
April 15th is not that far away. You've got a decision to make. Everybody, you take the standard deduction, or you itemize. What most people do is they calculate it both ways and see which one saves you more money.
Yeah.
For lots of folks, if you've got a great big mortgage interest expense, you know you're going to itemize. If you rent and you don't have that big mortgage expense, you're probably going to take the standard deduction. Well, if you look at those itemized deductions, one of them is for medical expenses. But you can't just take all your medical expenses as a deduction. There's a floor, meaning you can only deduct those medical expenses that exceed a certain percentage of your AGI, your adjusted gross income. Okay. So before Obamacare, that threshold was 7.5% of AGI. Under Obamacare, they raised it to 10%. Maybe this is a symbolic gesture, but what the GOP plan does is they lower that threshold back to where it was before it was changed under Obamacare.
Get rid of that.
It's back to 7.5. So you might have more people itemizing than you previously would. I'm guessing this wouldn't affect a whole lot of people, but you know, if you're going to itemize and you've got these medical expenses that are eligible, the floor is not as high, so there's going to be more savings to the individual. And then just a last point, kind of a little bit of minutia here, but tax forms are going to change. Yes, there's something called a 1095 form, which is this form, and there's 1095A, B, and C, and there's different variations on it. But basically, it's a form the IRS has to deal with that's got a little box that's checked on it, and it says, you know, here's Bob for how much of the year did he have insurance coverage. Because if I didn't have insurance coverage, I'd have a tax penalty under the individual mandate, which of course this plan would repeal. But the way I read this, the 1095s might go away completely, and you just look at the W-2, and there'd be a little box on the W-2 that would either be checked or not checked to indicate, was this person eligible for health insurance. Not whether you actually had coverage, but were you eligible. Because when we talked about those tax credits before, in order to be eligible for them, you cannot, you can't be benefiting from health care someplace else.
Okay.
All right, so if I'm eligible for health care through my employer, tax analyst, that little box on the W-2 gets checked. And then I'm not available for those tax credits.
Oh, okay, got
All right.
All right.
So it is, you're still going to have coverage through your employer if that's an option to you.
Yeah.
So
otherwise.
So that's the list so far.
Lot.
That's a lot. There could be more that I haven't found yet, but lots of changes.
We'll keep looking.
Yes.
All right, so let's talk about the politics now and the likelihood of this actually even getting through Congress. We know Speaker Ryan likes the plan. We know Ways and Means Chairman Brady likes it. President Trump has tweeted support of it, so we kind of assume that he likes it as well. Yeah. So that would seem to bode pretty well for its chances. But are all the Republicans on board with this plan, and are there any competing ideas out there? Is this the only game in town?
This is not the only game in town, which makes the politics fascinating. And we're not endorsing one thing or another. We're just objectively saying what's going on here. There was a press conference just recently where one member of the Senate, one member of the House, very conservative folks, came out and said they don't like this whole repeal and replace things. It was Senator Rand Paul from Kentucky and Congressman Jim Jordan from Ohio. They said that the Republican Party, as they see it, is unified on the whole repeal concept, but they don't like this bit about replacing it. Probably for the reasons we discussed, where you do have the IRS involved in administering the healthcare system. You're substituting one type of mandate with another type of quasi-mandate. You're definitely substituting one form of tax subsidies for another form of tax subsidies. They don't want to do the replace part. And Congressman Jordan said he's going to introduce a repeal-only bill in the House, and Rand Paul said he's going to do the same in the Senate. And the problem that creates, it means this plan that Speaker Ryan and Chairman Brady like so much. It's not going to be the only game in town. If you're a Republican lawmaker, you're going to have a choice. You can do repeal, or you can do repeal and replace, and that opens up a whole can of worms.
Oh, absolutely.
In addition, so those are examples of people that are sort of like strict conservatives who don't like the replace part of this. There's other folks, all Republicans here, who signed a letter, sent it to Senate Majority Leader Mitch McConnell, saying that they're worried about what's going on with Medicaid. So we have Medicare and Medicaid. Medicare is for the older folks. Medicaid is for the poorer folks. Yeah. With Obamacare, there was a big expansion, the ability for states to expand their Medicaid coverage. It could go up to 138% of the federal poverty level. So as a result of that, there are a lot of people, millions of people across the country, got on Medicaid who previously weren't on it. Yeah. But not all states. I think it was 31 states decided to do that. Okay. So what the GOP plan would do, it would allow that Medicaid expansion to remain in effect through the year 2020. And between now and 2020, you could get on Medicaid if you wanted to. But from that point going forward, no. It would start to scale back Medicaid after 2020. And that has some people worrying. There's some stuff, if you go on the internet and in the New York Times, there's estimates out there that maybe nationwide, well, it's not really nationwide, it's in those 31 states that expanded Medicaid. There's about 11 million people there that could end up losing their coverage. So you have 4 Republican senators, Rob Portman from Ohio, Shelley Capito from West Virginia, Cory Gardner from Colorado, and Lisa Murkowski from Alaska. This was on Tuesday. This was the day after they released this. Yeah. They sent a letter saying they're okay with repeal and replace, sort of, but they have a problem with how the GOP plan treats Medicaid, not Medicare, Medicaid, in years going forward after 2020. So it's not an immediate problem. And again, the politics are interesting because you're going to have mid-year or midterm elections in 2018, and this isn't going to be a problem until after that. And even the next presidential election is going to be in 2020, and this won't be a problem until after that. But what these 4 Republican senators are saying is they've got people in their states that voted for them, their constituents, who might be in a world of hurt because they'll lose their Medicaid, not now, but they'll lose it later.
After 2020.
So the significance of that is you could possibly see Republicans in the Senate not voting for this plan if it makes it into the Senate. What we think is going to happen, the timeline that's been outlined, is that they want to wrap all this up in about 2 months.
Very fast.
Very fast. In fact, as you said, there's a markup today in Ways and Means.
Yeah.
Right.
Probably still going.
Right. So they want to get it through the House in just like a week or two, send it over to the Senate, have the Senate look at it, sign it, pass it, vote on it, get it out of committee. Probably don't want to have too many hearings, and then try to get it to President Trump's desk for him to sign. They want to do all of that in 2 months. So they want to fast track this. And it might not get the votes if you have these people, and again, they're not Democrats, okay, they're Republicans. They're worried about the local Medicaid population in their states. They're saying they cannot go along with it. The letter had some very strong language in it. It said, as far as they're concerned, although they want to do repeal and replace, a precondition for them is dealing with the Medicaid population.
All right.
Okay, so there you have it. So there's 4 votes right there that look like they're in doubt. In the Senate, you've got Rand Paul, who says he only wants to repeal and not replace.
Yeah.
It's going to be interesting.
It definitely will.
I predict there will be drama. So
there always is.
Always, yes, and taxes.
And drama and taxes.
They go along.
Yeah. Yeah. All right. Well, thank you so much. I think we've learned a lot, but there's going to be so much more to talk about.
Stay tuned.
Yeah, stay tuned. We'll have to definitely revisit this topic again once we know a little bit more after the markup and probably in a little less than the 2 months time. So thanks for joining us and have a wonderful Wednesday.